Very excited because got it. We're bringing this model to New York now with the Mental Wellness Equity Center, and a part of the package, the programs that we're offering, are connection to social services, and we see and hear similar things, especially for men. That with COVID and the pandemic, New York was hit very hard, and there are a lot of inequities that were heightened during that time, especially economic. And so we believe that
Oh, Jennifer, you might have frozen for a second there. Hope you come back. Are you with us now, Jennifer?
yeah, it says my internet's unstable. Do you want me to repeat anything? Did I cut in and out?
I think we caught most of it, but we lost you when you were talking about transitioning some of this work or expanding some of this work to the New York context. And I don't know if you want to pick up from there.
Okay, sure. Yeah, so we're bringing this task shifted model, the training of community counselors to work in community clinics in New York City, people who are not specialists. So they have maybe a bachelor's degree in psychology or social work to deliver mental health interventions. But what I was sharing was that, New York was hit very hard by the pandemic, and we saw a lot of inequities heightened during that time, especially economic. So the mental health program and services that job security and getting other basic needs met really impact mental health.
Great, thank you. And there was a little bit of a glitch there, but I think we heard everything. And speaking about longstanding inequities, but also evolving inequities within the pandemic context. So thank you so much. And if I missed something and there are any kind of gaps from Jennifer's comments there, feel free to ask follow-ups or prompts in the chat too. But thank you for starting us off. And then maybe we'll go over to Francine, and I put the question in the chat there if you do need a refresher too.
Sure, thank you. Always good to have those refreshers. So, I mean, again, I'm going to speak to the context in which I work and that I know. But I think that, looking at parents and looking at societal expectations that are deeply gendered, I think this creates huge stressors for parents. So we know that there's a lot of data and there's a lot of sort of media coverage about how the transition to parenthood can be really challenging for mothers. But there's a lot of recent data that shows that fathers' mental health can be impacted just as much as mothers. So I think sort of the latest numbers around that are, 10% of fathers are experiencing perinatal depression, and 15% are experiencing perinatal anxiety. And we obviously see that there's a lot of shifts in terms of gender roles, and fathers are playing much more prominent roles in those sort of child rearing practices. But we would also note that a lot of the support sort of haven't caught up to that. And particularly in the work I do, when we're looking at folks who are, experiencing a number of health inequities already, I think we're seeing that fathers don't have access to the same number of supports or programs that mothers do. And I would just note that I think it's crucial to consider the socio-historical context and political contexts in which people are parenting. And I think that often isn't considered. We're often, conversations around parenting are often looking at like kind of white middle class parenting, and excluding people who aren't sort of fitting within those roles. Again, I think also, when we're looking at the key drivers of inequities within this population that I'm working with, we know that men are at higher risk of also experiencing trauma or violence, which clearly impacts mental health and well-being of these individuals. And this is often exacerbated when people become parents. And as Jennifer, alluded to, the COVID context has really heightened a number of these issues. So again, I think the lack of programming available for fathers and the limited supports that they have can kind of increase that social isolation and again, lead to mental health concerns for those men. And I'll stop it there and pass it over to Sarah.
Great, thank you.
Thanks, Francine. So I will also speak to my own area of work here, interviewing men in New Zealand around their mental health challenges. And I think these three key drivers that have become really apparent to me in the last few months of the research that I've been doing. And, the first one is so key to the New Zealand context, and it's the downstream impacts of colonisation. And so we know here in New Zealand that colonisation and racism is really one of the biggest drivers of persistent health inequities in general in New Zealand. And we know that Maori, our Indigenous population, experience widespread mental health inequities compared to non-Maori. So we know that they have a higher prevalence of mental health problems. They have higher rates of hospitalization for mental health disorders. They have higher rates of seclusion. We also know that they have more difficulties in accessing care. And for men in particular, we know that Maori men make up the highest rates of suicide here in New Zealand, particularly in the 25 to 44 age group. And so in my own work, I've had the privilege of being able to speak to Maori men, and they've told me stories of their experiences of racism and bullying starting really early on in school, experiences of being in state care, structural racism, generational trauma and disconnection. So it's a really key driver here in the New Zealand context. The other one is discrimination. So I've spoken to a number of men who identify as gay and bisexual, and we know that they experience poor mental health outcomes and higher risk of suicide. And again, the men that I've spoken to have talked about stories of trauma going right back to childhood, bullying, rejection, negative experiences in young adulthood, and also internalized stigma in relation to their sexual identity, and a lack of services. So that's come through as a really key driver. And then the third one, it'd be remiss of me not to mention gender and masculinity as a driver of mental health challenges. And that intersects with all the other social determinants to create mental health inequities. And I've certainly seen it in my own work. And interestingly, when you look at the intersection between masculinity and employment at different ages, at different life stages for men, there's inequities at different stages. For example, I've spoken to young men who feel a lot of pressure about having successful careers. I've spoken to middle-aged men who are balancing work and family commitments and really struggling to find that work-life balance, which is impacting their mental health. And then I've spoken to older men who've experienced job loss and redundancy after years of a long career, which has really created a sense of crisis and a loss of dignity. So there's definitely the gender drivers that underpin a lot of these determinants. So those would really be the three key drivers that I see within my work here in New Zealand.
Great answer. Thank you so much. And it's nice to see I don't know if consistency is the right word, but cohesion across the three of you around, taking one like a multi-level approach. So considering like individual, service level, and social and structural issues. And then Sarah, especially you summarizing that intersectional focus. So not just thinking about men, but how are we considering race, ethnicity, indigeneity, gender, sexuality, and more. So thank you very much.